Should we just dive right in?
Yes,
Um,
no, please.
all right. So let's talk about why. So, one of the top complaints that I hear when it comes in terms of pregnancy, especially I'm very pregnant myself right now, is that people complain, one, of their feet getting bigger, and then two, of having like flat feet or dealing with different pains around the feet. Why does this happen?
Yeah, so you actually will see a lot of changes in your feet with pregnancy, and it has to do with all the hormones that are
Mhm.
flowing through the body, especially as you go into the last trimester. So if people haven't, who are listening, women have had maybe multiple pregnancies, then you've had these hormone fluctuations more than just one time that each successive pregnancy, women will say, oh, it was the second or the third that my feet grew larger, etc. And that's because there's over 100 ligaments in our feet. So when relaxin hormone starts to increase, especially the latter part of the pregnancy, it's not just affecting the ligaments of the pelvis, but also the ligaments of the feet. So what I actually tell my patients, which some of the listeners might be surprised to hear, is I will actually want to put them in arch supports in the third trimester, and then really the fourth trimester as well, when relax, it takes a little bit for the hormones to normalize, and then you're just getting your strength back post birth. That really those next 3 months after giving birth, you still want to think about supporting the foot and protecting the foot.
Are there particular like sets of exercises you recommend for people or things to focus on outside of what we're wearing on our feet?
So I'm a huge proponent on releasing the feet. I know that
Mhm.
people get really nervous about releasing the feet, especially if you go to a massage place, they'll say, we will not touch your
I know.
feet because that can induce labor, which I actually used it to induce my labor. So it does work.
Amazing. Didn't work for me,
Yes,
let me tell you.
really. Yeah, no, I had a 2 hour foot massage to induce labor. But to still get some sort of release to the feet. If it's not an aggressive trigger point release, you do want to do that. Um, be aware of your feet. I give really easy foot exercises like getting into your digits. So, like a forward lean, which is you just stand with your feet shoulder width apart and then pretend that you are essentially just kind of swaying forward or leaning forward. Really, really easy to get into the digits just so that your feet don't get sleepy.
Yeah.
And we know the pelvic floor is starting to relax as well,
Yes.
and your feet are so connected to the pelvic floor. And then it's really post birth that you focus on waking everything back up.
Yeah. I like to talk about too. I mean, it's so easy in pregnancy for your hips to kind of shift forward. And when we get that shifting forward, we kind of get that, internal rotation of the legs, and we can get a little bit more pronation, which leads to feeling that flat footedness that happens. So, really being conscious of that core all through pregnancy is so incredibly important too.
Yeah,
Um,
absolutely.
so, moving on, a lot of people were asking about toe spacers and does it really work and when would I really use it? And so many questions had come around toe spacers. So can you break down one specifically why your toe splay might be different from others and the understanding of how long we have to wear these or how much we have to wear them to really make a difference in some of the elements of the feet?
Yes, so I love toe spacers. I'm obsessed with
Me
them. And
too.
I have been recommending them to patients for probably a decade that I absolutely love them because they're so easy and effective to use. Now, I don't make any claims. Obviously, Naboso makes no claims around reversing
Mm-hmm.
bunions or necessarily reversing hammer toes. So I look at it more as a way to create balance, maybe de-stress the feet. It's a good stretch after you're in shoes all day. I do look at toe spacers as a balance tool. So when we
Mm-hmm.
have bunions and hammer toes, you actually shorten your toes or you deviate the toes, and the toes are so important for balance. So if anyone is concerned around balance, then toe spacers, toe alignment, toe strength, all of that is incredible. The toe spacers at Naboso, I did see some of the questions that people had sent in that there's clear and there's blue, and there's the difference with the Naboso ones are that they're soft They hook around the toes. They are intended to be really comfortable so that you can wear them all day, every day if you want to, if you need to. You can wear them in your shoes. They're easy to clean. And just a little teaser that we have a new version that is coming out soon. So stay tuned. Just because we are continuously innovating and improving our products. So we want our toe spacers to be just continuous, the highest quality, the longest lasting, to create the best display that people can get so that they really get the benefit of what the product is intended for.
And it's really incredible. I mean, I've had friends who put it on for 10 minutes, they take it off and they're like, oh my gosh, my pinky toe moves again. You know, it's really incredible the feedback that you can get from the body and the brain immediately after you create some of that space, create some of that stretch that our feet are not used to, especially being in traditional socks and shoes. And so I mean, the impact of what wearing toe splay can do on your foot health in such a short period of time too is really, I've seen some pretty incredible benefits. So definitely get the toe splay, use code optimal. You get a little discount.
Yes.
And then bunions. So a lot of people were asking about different issues with bunions, whether it's in childhood that they're starting to see it in kids, or whether it's when you're older. What can we do for bunions and what is most effective? Because there's also a lot of tools out there that people get marketed to that aren't usually the best.
Yeah. So bunions, what I say, and as a functional podiatrist, I try to give people kind of the realistic approach of what they can achieve. I give exercises. I was trained as a surgeon, so I find that that's an important perspective of how I approach patients, knowing the appropriateness of surgery. And sometimes I do recommend surgery to my patients, but bunions are not reversible without surgery. And really what a bunion is not just the deviation of the toe. The bunion is the opening of the metatarsal. So when the metatarsals start to open, which is in the middle of the foot, the swinging out of that first metatarsal is what makes the bump. So the bump is the metatarsal head, right? So to correct or reverse a bunion, essentially that metatarsal has to come in, the head has to come in. And you can't do that without surgery because you have to cut the bone and shift it, right? So I think having that realistic understanding of, okay, a bunion. So could you move the toe over with things like toe spacers so you get a more centered joint, a more clinically, so when you look at your foot, the toe looks straighter, right? That's kind of a clinical presentation. That's not a x-ray presentation, but the toe looks straighter. Great, right? So we're achieving that. I think if the individual, the consumer, the patient, whoever it is that's curious, has that realistic understanding. And that's why with patients or at Naboso, we never say, oh, the toe spacers will reverse your bunions. If you do short foot, if you wear minimal shoes, you'll reverse your bunion. That's not really true. So what I would say around that is that one of the most common causes of bunions is ligament laxity in the foot. Or weak. It's not that the shoes itself are narrow and that's what's causing the bunion. There's an inherent laxity in the foot and in the middle of the foot. Could you bring stability to the foot by strengthening it? Sure. I know that that's what you teach, a lot of that. Could you wear wider toe box shoes so you're not pushing and kind of pushing you towards the bunion that you have a predisposition for? Sure. So that's kind of how I like to look at a bunion from a functional perspective.
So we're looking at like people who are dealing with hypermobility and laxity within the feet are more predisposed to having bunions.
Correct. Yes. So it's not just, again, you have weak feet and that's why you have a bunion, right? Does it contribute to it? Sure. Now, so children who get bunions. So if you have a teenager who has a bunion or a 10-year-old, I've actually seen 10-year-old children with bunions, there is always ligament laxity that is contributing to that. So that is not that 10-year-old's feet are weak, right? So
Right.
it's understanding. It helps you to navigate it with a little bit clearer understanding. And, again, I try not to blame directly one thing, because we're very complex and it's multifactorial. Everything is multifactorial, right? But if you understand it, you understand your foot type, and you get into a healthy foot habit now, then you are setting yourself up to slow the progression of a bunion, right? And that's, again, why I love programs that you created, because it gets people preventive versus reactive. And that's really how you want to approach these things as well.
For everything in the body. I wish people took more of a preventive approach, right?
Yes.
And what's cool, the guys over at My Foot Function are actually coming out with a study pretty soon. It covered 3,000 people that they looked at, so it was a large sample size. It was in Sri Lanka, and so you have a wide range of, from poverty to, being in shoes all day. So those who weren't in shoes versus those who have maybe a job that puts them in boots or in, footwear, there was a distinct difference in those who had bunions versus those who did not. And could that be because they didn't have shoes and footwear? They're strengthening their foot so much more from birth, because they were never in shoes really a lot of the time. So it's just a very interesting study to be able to see that and the impact of shoe wear for really looking at a large sample size. Now, when it comes to plantar fasciitis, that's probably one of the next biggest things that people always want to talk about and understand. Why do we get plantar fasciitis? Like, where's the root cause of what that comes from?
Yes, so plantar fasciitis is, I look at it as an impact-related injury, which means you're walking, you're running, whatever it is, how you're hitting the ground, you are relating to the ground, you're relating to impact forces, and you're relating to the transfer, so the load and the unload of impact forces. So it's related to that, right? In most cases. Sometimes it could be persistent, prolonged standing, which could cause it, which we could go into that as well. But the plantar fascia, which is like a thick rubber band on the bottom of the foot, plays an important role of, really, it's called arch compression. So when you load the foot, you're compressing the arch, so you're stretching the rubber band, which potentiates it, and then you recoil it when you're taking the step. If you have either insufficient foot strength, an unstable foot type, you've just overloaded that rubber band mechanism, all of those are just different reasons of what could contribute to a little injury. And then we essentially get into this vicious cycle of, there was a little injury, it didn't fully heal, and then you stressed it again, so now that injury becomes a little bit bigger injury, and then we just get into this state of like stasis. So I approach plantar fasciitis very differently than I think a lot of other podiatrists, in the sense that I'm trying to get control of the situation first. And I put my patients in this 2-week, I call it putting out the fire. And I'm essentially trying to get control of the situation. A lot of them, that's all that they need. They just needed a very controlled, systemized way to bring support, minimize stress, start to bring soft tissue mobility, and then reintroduce stress, etc. Some, if they don't respond, then it's looking at it a little bit different. And oftentimes I find that they actually have partial tears, they have degeneration, they have thickening. They're essentially stuck in the tissue healing cycle. And then I will do regenerative injections for them and then take them through a foot strengthening protocol. So what I would say for the listeners on this, because there's so much information around plantar fasciitis, and I'm sure a lot of listeners who have heel pain have tried many, many things,
right.
Is to really get an understanding of what type of plantar fasciitis you have, or plantar fasciopathy that you have, Is it acute? Is it chronic? Is it waxing and waning? Is it cyclical? Is this the first time you've ever experienced it? Have you had it on and off for 5 years? Have you had it for 6 months consistently? Just where are you in that journey? And then it helps me kind of think of what is the state of the tissue, and then you have to treat that. Then I will look at systemic contributors, meaning, oh, you have a weak pelvic floor, your foot to core, you have underactive right glute, like whatever it could be in the movement pattern that contributes to it. Then I look at the system globally and start to factor that in. But until I get control and understand the connective tissue, I often find that those patients don't get better either. If they're looking at like really what caused this in the first place, that might be one step too far ahead from where they need to be right now.
Well, and what I love what you said too is because what most people think is plantar fasciitis. So it's an inflammation. I just need to put ice on it. And if I rest and put ice enough, it's going to get better. And that was not part of anything within your answer, which goes back to taking control of identifying, okay, what's happening within that tissue? How far in that tissue healing are you? And where do we need to start from in order to get back into strengthening? Maybe we don't need to start with strengthening. Maybe we need to start with other things. And then looking up the chain and how the whole body is connected, I think is really crucial. We don't understand sometimes how much the role of our core and hips and strength of our entire pelvic floor play a role down to what our feet are doing throughout the day and how we're standing, how we're walking, how we're moving, and how incredibly important that is. So I love that you highlighted and touched on all of those things.
If I could just mention real quick, so Carolyn made a comment that she has had plantar fasciitis for almost 2 decades. So that would be an example of a patient that I would be like, Carolyn, we need to understand the state of your tissue. And my guess is that she has thickening degeneration. She probably has a partial tear. And my goal is that I would love to help her finally get past that, where sometimes I will approach patient, or oftentimes I have a little bit of like a YOLO thing where I'm like, come on, like how long? Like I just wouldn't want Carolyn to keep experiencing this for another decade, right? So let's get some imaging. Let's look at what's actually happening in there so we can finally get her in a state that she will feel better. But there's a lot of people who are like her that have pain for that long.
Well, and what the issue with that as well is that if you go to a general practitioner and you go and get imaging, what is the typical recommendation from there? You know, how do you know who to see? I mean, obviously, if they can go and see you and get imaging with you, that would be best. But how does someone know like where to go when it's been so long that they've been trying?
Yes. So what I often will guide people to say is, so it would be a podiatrist really is who you would want to see. But if the podiatrist is a little bit lackadaisical, which unfortunately a lot are, and they might say like, just live with it, right? Get some orthotics, wear supportive shoes, and live with it, right? I would go in and say, no, I need some imaging. I want to understand what this is and kind of push for it. I also happen to be huge. Part of my mission is patient advocacy and pushing and questioning things. And if they say that is the only option, then kind of push back a little bit and say, well, no, like, is that really the only option? Is there another imaging? Is there something that I could do, especially within the regenerative and functional medicine space, is just what else is there? Because oftentimes when they're like, then there's got to be someone else that they can send you to.
Right. And when it comes to, you know, general foot health, I know there's so many other aspects that you recommend as well beyond just, you know, wear a particular shoe or wear an orthotic. What else should people really be focusing on when it comes to whole foot health and how to maintain a healthy foot as much as possible?
Yes. So I advocate for 3 pillars of healthy feet. And those pillars of healthy feet, well, actually, I'm going to add 4. There's a bonus now. It kind of falls under. But first pillar is foot awareness. So do you feel your feet? Are you stimulating the nerves in the bottom of the feet every day? Take your shoes off, get on texture, get on vibration, get on pebble paths, go outside and ground. So you're just doing something for the sensory side of the foot. That is the first pillar. Second pillar is foot strength. So that is strengthening the intrinsics. There's 26 muscles in the bottom of the feet that play a very important role in foot posture and absorbing impact forces. A lot of their activation is actually in the toes. So toe strength, we essentially translate to foot strength. So that's very important. My sub to that, or my bonus pillar, is balance. And having the ability to stand on one leg is extremely important, not just with age, but it's extremely important, and was one of the most important skills that allows us to walk. So if you want to walk well, you want to walk fast, you have to be able to stand on one leg. And then the third/4th pillar is recovery, and doing something to recover your feet every day. We take 5,000, 10,000 steps a day, and you need to do something to essentially reset your feet. That's why I like the neural ball. My shout out to the neural ball, and do a 2-minute foot release at the end of the day.
I
is
have it
amazing.
right there.
Yay! Yes, I love it. And then thinking also of circulation. So foot circulation is really important for recovery. That could be through the neural ball, that could be through vibration, that could be through foot massage, reflexology, texture. There's different ways that you can support circulation, but that aspect of recovery is extremely important.
Love all of those, and hopefully give someone, you know, a bigger, broader picture of what to do. It's beyond just foot exercises or getting in a different shoe or wearing orthotics. There's so much more that we could be doing to really support our whole foot health. And going on to orthotics real quick, at what point do we say, okay, do I just rely on the orthotics, or do I start to implement other things? Like, is it okay to still be in the orthotic if that makes me feel better? Is my goal to work out of the orthotic? Does it depend? I know that's a huge question. So
yes. So what I get a majority of my patients out of orthotics, and I've over the last decade have taken many people out of orthotics. However, there are some exceptions that do need orthotics. Typically, that is the ligament lax foot, the foot that has a torn post-hip tendon. Maybe they have Carolyn, who had her plantar fasciitis for a decade. She may be scared to get out of orthotics now. So there's a time and place for orthotics. Now, having said that, when I tell patients that they have orthotics, I'm like, this is not a magic insert. You are still getting foot exercises. You are still needing to spend some time without your shoes on and getting the sensory stimulation, waking up the feet. So the way that I approach foot health and foot posture is you may be given foot exercises, or you may be given foot exercises and an orthotic or an arch support. So it's never just one or the other. I never look at orthotics as just that's what you do and you're good.
Exactly. And I think that's so important. There is a time and place, and there is, you know, reason to have them, and there's reason to continue to work on your feet despite that.
Yes.
And I know that one question had come through about like, well, what type of imaging should I kind of get? So I just want to wrap that portion up really quick. Is it an MRI? Is it an ultrasound? Is it an X-ray? So what kind of imaging do you really recommend on the feet?
Yeah. So I would recommend an MRI. You could do an ultrasound. Ultrasounds are easy, they're cheap, they're quickly covered by the insurance. X-rays for soft tissue, it's not going to show anything. And a heel spur, we didn't really talk about that, but heel spurs, if you see a heel spur on an X-ray, it doesn't mean anything. It doesn't mean anything to the patient. It tells me, the practitioner, as I'm looking at the X-ray, I'm like, you've had a lot of tension on your plantar fascia for quite a few years, that it's creating this spur that's extending out of the calcaneus purely because of tension. So if you pull your plantar fascia, Wolff's Law is that your body is going to essentially lay down bone in the direction of tension. An MRI is going to be soft tissue. It's going to be specific. You do not need contrast. So it's an MRI without contrast. You can get that covered by, almost every insurance and proceed. If some people happen to not have insurance, what I tell them is you call a radiology facility and try to essentially negotiate with them as a cash paying patient. You just say, hey, I'm paying cash. How much do you want? And then oftentimes they'll work with you.
Yes. And anyone who is checking out the Naboso, I know I see some things going around about the toe splay and the neurobot. I absolutely love that. Use code OPTIMAL. You get a little discount with that as well. Let me just scroll back really quickly. We have like a couple more minutes here with Dr. Emily. I hope that we've covered a ton of information that really helps to get a better understanding. You have a little one trying to get in.
I do.
Trying to get in a better understanding of the foot. Dr. Emily and Naboso both have incredible information on their pages in terms of learning more about foot health, especially Dr. Emily's page. So just go up here, go give her a follow if you are not yet. So that you can get all that good information that she continues to drop on there's just too much, so I can't really see. Yeah. And of course, and I also have a barefoot mini course if you guys want to dive in and assess the feet, get a couple exercises that are going to be helpful for where your foot currently is. Anything else you want to add to that before we hop off?
Yeah. So, the one last thing that I would add is understand your foot type. And I know that you speak a lot on that as well, is question things, understand your foot type, understand that your foot health, like your entire body, you are an owner of it. You are an advocate of it. You're an active participant in the health of your feet and of your body. So definitely prioritize it. Even if you do not have any foot pain, that does not mean that you get a buy on all of these recommendations. Like, you still want to make sure that you're prioritizing it, because honestly, it plays such a critical role in the entire rest of your body that your feet, you don't have to have foot pain to have it be a priority.
Exactly. Prevention over reaction. That's what we want to get, so that you don't have to worry about it once it comes. So start doing these things that we're talking about now before you have the foot pain. I think that's so huge. Well, Dr. Emily, thank you guys so much for joining on. I know there's so many more questions and people have more questions on different things. We've also done a couple podcasts together on the Optimal Body podcast. You can hear her speak at length in terms of a lot more information. She's also a guest within the Barefoot Mini course, where there was a ton more questions about different shoes and just so much more stuff. So a wealth of information, a wealth of education. I really appreciate you coming on. And again, use code OPTIMAL for anything Naboso type products. We love them, we use them, we have them, and highly recommend them. So thank you.
Awesome. Thank you so much.